father of NSS. So what basic NSS requires or university needs is, what you have to do here is, you have to work for the 240 hours, 2 years. Means 120 hours, activity hours in per year. मग तुम्ही विचारणार सर हेच करत बसलं तर अभ्यास कधी करायचा? All this you have to do with the university is going to be have the 250 units of this all medical institutes having the under the MBHS. So what is important is one residential camp, it was previously 10 days, it is made to the 7 days. And now we have to take the residential camp or special camps or special camp activities 7 days. Means you have to visit to your adopted village or camp selected village, and you have to stay there only, understand the problems of the society, then you can work on that. You can do the all guidance relating the village problems also. So then only it is we call as a special camp activity. It is 7 days. Then regular activity, you have to work. Whatever you are invited me, means you are working 2 hours my lecture. Before that 2 hours you are work, and after that you are reporting 2 hours. One activity you can show as a 6 hours. So this one activity it will cover 6 hours. That way you have to present the all this NSS. So what are the activities I conducted under the heads of the 7 days? What we conduct in my special camps? What I conduct usually? This all report may includes my 3 years of different activities, which are represented and for the award, and that report was considered. So what we can do, environment awareness rally. People, you have to save the water, then you have to tell them that is the plantation, tree plantation, save Vasundhara. With these themes you can work and make the awareness of this. This is what you are going to do. That is awareness is created in the village. Second, distribution of the families. My students who are there, every day, 2 days are kept according to the population and homes present in the village. We calculate 1,000 homes, and we have to do health hygiene, and we are going to get that is the relating the health related other issues. So here almost all families are daily. My student 2 people, 1 male and female, or 2 females in the village. They have to go to the doors and they have to introduce themselves first. I am a so and so student of the college. Here we are doing the camp, and I want some details that can you give. You have to take permission. सर्व गावात गेले आमचंच गाव म्हणून जायचं नाहीये. So that you have to take the permission. If they permit you to give the details, then only take. Otherwise you can go. So details which is survey form is there. You have to take and survey that is submitted to the Gram Panchayati, because this is the one pilot study relating the education, health and hygiene. Education, health, hygiene. These 3 can be done, and this report should be submitted to the Gram Panchayat or the village leader, where this can be utilized as the one pilot study relating their village. This is specifically considered by all district coordinators, all collectors. This is the one true pilot study. Then next, health education awareness family community level you have to do. COVID-19, we have gone for the fever clinic, vaccination awareness, COVID-19, post-COVID complications, all that camps I have conducted. These all camps which I am telling, this is not the others or the national level. These are my activities done, those are named. free homeopathic treatment camp. You all do this as I always your media. I like and see that every your Facebook of your college account. I personally like also because good activities are conducted in this institute. So that is the plus point. Only you have to modify few changes and you will be the main active unit in the Maharashtra. Then I am talking about the homeopathic awareness. You have to be aware. At least you are practicing in this. The people who are coming for the homeopathic treatment, you can transmit to them skin disease they are having. Transmit, I will give you homeopathy, you take it, and you can change the patient from the allopathy to the homeopathy. This is homeopathic awareness. शब्दानं गोळा आहे, हे गोळी कमी होत नाही, असं misconception आहे, हे काढायला पाहिजे. These all things which are related to your future and practice and your bread and butter. So meanwhile, you have to create the awareness. Blood group and HB, simple one, where technicians are needed very less. We can do the HB for the rural female in the villages anemia. They are suffering, that we can do, and almost all after post-COVID, we are going to have the blood group is required and blood investigation like a blood sugar. You have to tie up with the social other teams of the village, then you can do. Program against superstition, you can Kundabari, you can save the baby girl, and all prevent the corruption. These all you can take as these street play you can present. School health checkup. If you are visiting to that particular village, you have to go and visit to the school. Guide them for the hygiene. And practice whatever you are doing. All these children you are going to face. Tell them what is the hygiene, how you should be there, how you practice. That all should be done. Pediatric health camps, you can different female disease diagnosis, pediatric camps, orthopedic camps, and NSS volunteer especially. You have to take the topic and you have to give the lectures in the school so that you can create the awareness in the students. So these we do in the special camp activities. Eye checkup we arrange one day, cataract operation, many loins and all, they do free cataract operation. So these all activities which we are going to tie up with the many institutes, many social working group, so we can do. Cancer awareness campaign, I have the big institute in my area, Miras, Siddhivinayak Cancer Hospital. We are going to advise only females for the breast cancer, early diagnosis of the lump in the breast. You do this one, you will save the many women where they can land up in the third stage of cancer. That can be prevented. Simple one examination, mammography or simple examination of the breast. As I am an anatomy teacher, we give and teach how the examination of the breast, why it is important for the women. Because cancer is spreading, lump is there, they neglect, painless, hard stony. Then they land up in the third stage where spread it to the metastasis. Then you are cannot save the woman. But one simple lump, we will do the mammography and we can save the woman properly where she can die within 3 years of next with the cancer. So we usually invite Dr. Pathak Madam for the advising. Only women we call one day as a Hardi Kunku we call invite and them together we guide her. This will be done and that is the one which is. Swachhata Mohim, we do Swachhata Mohim of my institute I do, where till 2nd October I am going to plan in the popular areas of the Mira city we can do, or your institute there, or you can present it as one of the garden or near which is requires the hygiene. There you can go and work. But here we have to do the physical work. That is I am talking. And de-addiction And hypnotism is also I include in the my special camp, because one of the student who is do this hypnotism. One of the student is specialist in the hypnotism, and we call and who are not having the concentration, less concentration in the study, they are not listening, they are addicted, those people or those students we invite and take on the stage, and he will hypnotize. He is my student who will be saved, that is indirectly to the society addiction. That we arrange, or this is hypnotism. This is not given by the guidance of the all NSS unit. The next, yoga and pranayam and good health you have to take out. In the every camp, every day, you have to perform this and you have to report. Yoga and pranayam you have to make. Then cultural activity. To create the awareness in the society, you have to do many cultural activities. Awareness, educational activities. Cultural means dance, lavani, asana. Okay, we are going to do the awareness, that is we can do. How to become ideal village. This concept is mine because I have visited to the Yaligouda city. I have told why Yaligouda city is awarded by the President of India as an ideal village, and one more, that is a village which is we call as a that is even near to the ground. This village was awarded that time. So how to be an ideal? This you have to guide to the your leaders of the village, sarpanch, all members of the gram panchayat. You have to guide why your village should not be the ideal one. When I have visited to the even that is Yaligouda city, you have to visit in your life. Just you go and visit, you will see the change. I am not talking about the Anna Hazare or anything, but these drastic change you will keep in your mind. Hure Bajar what? All homes are same, clean. Every home having outside dustbin, and every home is labeled nameplate. First is woman's name, next is gent's name. First is written family woman's name, next is men's name. And all this is everything solar, all presented with the all clean and neat. Not a single paper is seen outside. That is Hure Bajar. So this is the two villages I have visited as an ideal, as a part of my training, NSS program officer by the NSS unit. We personally visited in these two villages. They have changed me a lot, and many people I advise that you should go for the ideal village. If you get ideal village, you are going to get more than 5 lakhs to fund to the village. You can build all sanitation, whatever requirement in the village, they can do. This is the one which is important. Class for the NSS volunteer. This is what I am taking. This is a class to you. Come regularly. Plan. Don't sit away. Involve in the team. Suggest the many your ideas to the your program officer. Plan. Work. Get the result. That satisfaction is different. So that you have to remember that this satisfaction is there, then only you will be the good social worker. And my intention is to that, not to become a good social worker, but at least your area, the people should invite you or call you. That is something he has done the work for the society. I practice in Malgaon. 3 times they have awarded me COVID warriors. People 364 days. One day I have not gone, that is Gudi Padwa. Every 2 years, my home people are not left. Today is Gudi Padwa, don't go for the clinic. Only 2 days I have left in the corona epidemics. So otherwise, because 65 instead of telling, I am talking about 364 days, it is an intention. So this is one class you will take it for the NSS. Regular activities, As you have NSS Foundation Day, tree plantation we have done, you have the orientation program, you have invited me, these you have to present. Then tree plantation, 50th August you have to keep the awareness program, you have to keep the visits. Wherever adopted village, you go and visit and you have to help for the community. The COVID-19 pandemic, that all responsibility workers, even we have done that time presenting the sanitization and mask for the health workers. Free of cost we have donated to all these health workers, including sanitization, mask, and even all important required medicines, homeopathic medicine, even arsenical. That was all work. Red Ribbon Express, this awares the HIV, AIDS, HIV and AIDS. This is the one central government planning. This Ribbon Express was in the Mirror Junction, and there all my students, NSS 100 students, they have guided to the 30,000 people, 30,000 visitors. They have created the awareness of HIV AIDS. So this is a big task, which is where that taken by the collector of the Sangli district, and whatever you do the activity, this was reported, verified by the university, by the collectors. Not it is that is only they give the awards and all, nothing. So this is the one which you have to remember. Then regular activities in that you can do, as you are already celebrating this NSS Foundation Day, many activities you can conduct. Environment awareness cycle rally, you can take World AIDS Day rally, 1st December to the all first week of that, we all celebrate as awareness of HIV AIDS. Swachhata Abhiyan. Timely the Nagarpalika, Gram Panchayat, they involve Sant Gage Baba, Swachhata Abhiyan. You have to participate in that. Taking care of yourself, you can participate. Then visit to the HIV orphanage. Nobody goes and visits the health checkup for the HIV AIDS affected. We go and visit. In the cook ward, we have the orphanage there with all precaution. I have to care my students who are working in that. We have to tell the all first guidance, and they have to check more than 45 small children affected by the HIV, no parents, orphanage. Those people, responsibility of health checking is done by us, our college, our NSS volunteers with the precaution. You will understand this in your practice, complications of HIV, HIV in children, what is the problem faced. So that is very important here. Again, one more orphanage we visit oftenly, Father Orphanage, old age people who are there. You have to go and visit. Only on your birthday or anybody's birthday, go and distribute the jalebis and come. No. You have to, health related guidance should be given. Not to distribute the fruits in the hospitals and in the orphanage school. Do that one. With that, you are the doctors. Your duty is that you have to be a part of the society relating to that health. So this is the one which is you have to remember. Non-violence Day and Peace Day, 2nd October we are celebrating. Khadi Day also, Khadi Day, Non-Violence and Peace Day we can, 2nd October. Free homeopathic camp on the World Health Day, homeopathic awareness camp, school health checkup. These are routine. School health checkup means we are not going to same visit. We have adopted 5 villages. In the 5 villages, which is guidance given by the NCH, requires for the inspection and institute, you have to go and regularly visit and you have to do the work in the adopted village. That is a commonly asked, that is a, which are the 5 villages you are adopted. Like regular monthly adopted village visits, you can go for the 2 months, 3 months, you can go and take the survey that can assess the addiction habit among the adopted families. You have to choose the families which are sons are adopted with the bad addiction and go and convince them, guide them. That is one which you can get. And screening of oral cancer community, again I say that civilian people will help for the oral cancer because new young people are suffering with the oral cancer. All they have the ulceration in the mouth and all, but this is diagnosis is must. You have to just oral opening and examining with a simple torch. You can assess this, you can prevent this. So this is the one which is, and Shiv Jayanti we celebrate with the big and all things which are, but whatever the guidance of Shivaji, we may follow or may not follow, that we have to keep in mind. College we celebrate as a big event. We take all the mauras and all palki and everything to big event, but it was next day we are not following. So our personally, I am there in the all committees of my college. I always suggest that at least you have to nature friendly, eco friendly. All the things should be done and it should be followed. My personal advice that is. Next, which is you have to remember about the free Jaipur food distribution. We have conducted it is as my chairman, Prithviraj Patil, is a politician. So political related also we do the some activities, but under NSS heads or the banner we do. But that is we have to do because it is indirectly social work. So Jaipur food was arranged by our chairman's guidance, and we have distributed more than 150 people to the hands and legs to the these handicapped people, and that is very one. And awareness of Save Baby Female and flood affected Sangli. As you know, 3 years back we are having a big flood, but now it happens in the, now it is in the area of Beed and all, it is a horrible. Where there is a drought, water is less, but in our areas we are safer now. There is no heavy rain, at least floods this year is not there, but you have to not to sit in the home, that time you have to be as an active worker. So this is the one which is you have to remember. After all conducting this, how to write the report, how university expects, how university you are going to present. This has the following heads. It is not that simply we have done and we have said, we post in our social media account, shall all status gone 24 hours after. But this should be there, whatever we have undergone, gone for the NAC also. In our institute, we've gone recently NAC accreditation. My whatever Facebook which is there, I have got 6 years back all events, photographs and all related reports in my Facebook, and about nearly 5,000 my photographs of NSS. NSS is utilized for the NAC. As under what? Under extension and outreach activity, as under NSS or social awareness, social touch, and your skill developments to the student. This asked by our inspectors of NAC. So these all you have to be prepared relating to the NAC as well as. So that helps, and we are always to take the guidance from the other people. We never, I am not perfect. And many times I contact many licensed officers of Pune and all. Whatever they guide us, we follow. University also guides us. Many people who guide properly. So that how to write the report, I was also not knowing. But what standard format which is accepted by the India and NAC committee and university is these heads. So that first you have to make the circular and all. When you conduct the report, brief report of the event you have tried, NSS Foundation Day, 24th September, you have conducted. Department of NSS you can put, or extension outreach activities. Then title of the program, NSS volunteer orientation, pre-plantation. Today I am talking, all you can make. Resource person, you can add time and date, today's, and you can include place in the college auditorium. The number of beneficiaries, you all are the number of beneficiaries which are 100, 120. That number requires with the attendance and signature. So that I am talking objectives, what you have done today, what you have learned, what is the objectives of today to learn, to orient the NSS, to make them to inspire, to involve and do the perfect activities. So this is all is done under the NSS activity. Then summary of the event. What you have learned, summary, you have to make photos. Now you have to take almost all geotag photos are valid. Otherwise, NAC committee and university is not going to consider geotag app is a geotag app. Photos should be uploaded and kept. For the print media, newspaper, you have to have substitute photographs of the plane also, and geotag, publicity and news. Then you require the simple photos and geotag for your report. Then attendance with the signature. You are all teachers who are attending, that is must. So this is the one which is the report writing. How I write report? Mine it is not the standard of any thing which is I conducted many events. Last my camp was in the February, Bisur. In the Sangli district, Bisur. There we conducted many. For the simple event, this is not done by teacher. I have not done this. This is done by my student, NSS volunteers. We made the male NSS in charge and female NSS in charge, and those people has to report daily. This report is not prepared by mine. This I have to give to my students because they have worked. So those heads are there, title of the program, time, place, number of objectives, you have to make like this way. So this is all which is a health, education, hygiene and cleanliness survey. Door to door. They have gone door to door, 800 families, 800 houses. So that they have visited 2 days. Every day, 2 people they have to visit to the door to door, 50 only house. 50. 9 o'clock you have to go and till 2 o'clock, lunch, break. Till that you can do the 50 families. It is not more than that also you can do, but 50 minimum you have to do. So this is all report, health education, cleanliness, organized activities to improve the sanitization facilities and all. This is the brief report of the hygiene health. The next, which is event of AIDS awareness street play, my students are done. It is there in my YouTube, very nicely performed by the student. Students are the main thing. It is a teamwork. Only student has to take the participation, then only it is possible. Otherwise institute cannot do, otherwise principal cannot do, not NSS program officer, nothing. It is all left to you. You have to work or you have to leave. Only simply in the my also college we have a group of people which are 5 or 10. They always remain late, they disturb, all there. Don't become so. Because you are the observed by the society. When you practice, thousands of eyes on you. When doctor is coming, he is regularly coming, 9 o'clock, going, patients treating, what is the interaction, what is the quality of leadership, what interaction done, what village he has done, anything. This is all observed by my dear friends. This is observed by the thousands of eyes of the village. Then only you are going to be a good doctor and good social work, and you should have the touch of social work. Then only you will be the successful. Otherwise, only knowledge I have, gold medal I have got in the university, medicine, no, big zero. According to me, is big zero. So what you have, gold medal is there, but there is no interaction with the patient, how to treat, how to interact. There is no skills. Then these two fields are not cooperative. So you should be a very properly, that is included 5 marks in the mark list in the final year and third year. Now it is mark list consisting your skills. Observational skill head is there. So we give all the marks accordingly, that is. So this is the one which is you have to remember AIDS awareness and street play. Then you have to remember about the few photographs I show you